bit. Hi, it's Dr. Daniel Ronel. I'm a board-certified plastic surgeon. You're listening to Talk 1260 KTRC. This show is Western Medicine. We're talking about the realities of plastic surgery. I'm here with my wife, Betsy Ronel.
That's me.
And right now I want to talk about aesthetic injectables.
Yes.
Okay, what are those? That's basically botox and fillers. It's when I inject things into the face to erase wrinkles, to plump up lost volume, that sort of thing.
These are the things used in the liquid facelift as well.
Correct. So let's talk about botox. Botox is most commonly used for those frown lines right in between the brow. It's used for the lines that go across the brow,
Right.
and for the lines around the face, around the eyes, the crow's feet. These are all fine wrinkles, and they exist because they're attached to the muscles underneath the skin. And so when you put Botox in, it weakens the muscle, so the wrinkle is lessened. There are plenty of other places where I put Botox. Upper lip, neck, but that's more facial shaping. That's something that is kind of advanced, and the most commonly requested thing is what I talked about, in between the brow and around the eyes.
That's what I get.
Right, and
But you know what's interesting with that?
What?
There are variations. Like you have some actresses and models who come into you, and they can't obviously be totally paralyzed.
Right.
I like to be totally paralyzed.
Right.
No movement, no wrinkles.
right, I think it's important to maintain some facial expression, and I think, you know, the myth of, your face is going to get paralyzed with Botox. Well, you know, that happens if somebody gives too much.
No, it can happen. If you want it to happen, it can happen. It can also happen by accident. But there are degrees. No, you don't. I like it for myself. There are degrees of Botox that you can inject depending on what the result the patient wants.
And you know, in reality, sometimes it's hard to predict how much Botox to give to somebody. Somebody one person may have much stronger muscles than somebody else, and one person may have been getting the same amount of Botox for 10 years, and then all of a sudden, it's too much.
Or it's too little, in my case, yeah.
Right, and so, like just today, somebody came back in 2 weeks after Botox. Didn't really work. I just gave her some more.
Oh yeah, that's happened to me.
I don't charge for that.
Yeah.
It's something that's required.
Right.
On the other hand,
nobody should be charging you for the addition. It's, you know, the proper thing to.
Right. You pay for Botox, you should get.
You get the result you want. Right.
No matter how many units it takes.
Right.
To a point.
Right, to a point.
To a point.
Yeah, people.
The opposite can happen too, is you can give a standard amount of Botox and it may just be a little too much for somebody. And what can happen is you can get weakening of muscles that you don't want to happen, such as a droopy eyelid.
The famous eye droop. I've had one, and I hear people complain about them all the time, and it really gets on my nerves because, no, I'm not going to go off on a tangent, but I've had one, and I'm like, oh, this is the famous eye droop I hear women complaining about all the time. It ain't nothing, girls. It goes away. Get over it.
It goes away. You know? It can be
I know that sometimes if you're on TV, I know there are some severe eye droops. That's different. But it's not permanent paralysis. It does go away.
Right.
It really does. Your body is healthy. It rejuvenates itself. It wears out the Botox. It eats it up. It goes away.
It does. It's no fun when you have it, and it's something that...
and maybe it's a little scary for people who have never had it before. I was scared when I saw it. I was like, oh, God, here's the eye droop. Ooh. But it went away in about 3 weeks. It went away.
That's the good news about it.
Yeah.
It does go away, yeah. All right.
So, that's it.
Okay, so that's Botox. The other things that we can do are injectables, and you know the standard one is called Restylane. That's sort of like the Xerox of injectables. Mm-hmm. Restylane is a little old. It's been
replaced by... What's the one everybody asks for?
The common one now is Juvederm, which is sort of what Restylane has become. It's the same product. It's a natural product that's already existing in the skin.
Oh, cool.
It's silky, smooth, lasts about a year, right?
Yeah.
There are like 20 different fillers out there, and the ones I've chosen are all a little different because they have different qualities.
What have you chosen?
The big one, the workhorse one for me, is called Radiesse. And that's calcium hydroxylapatite, which is what our bones.
Say what?
It's what our bones are made out of. And this thing lasts about 2 years longer. It lasts about 2 years, about twice as long as what Juvederm does.
Okay.
And it's the staple for the liquid facelift that I do. You cannot put it in the lip. That's the one thing you can't do, because it's white. And
Oh, it'll show through
yeah, and
the skin.
it doesn't look good.
What about in the eye, under eye area?
You can very carefully,
Yeah,
very
gingerly,
carefully,
right.
yeah, because it can cause redness and problems, as you well know.
Right.
Another one that has just come back on the market, which is one of my
Oh, he's
favorites,
thrilled.
is
about
called
this one.
Artefill.
Yeah.
And the reason I like Artefill is
Big
because,
time.
like Juvederm, it's smooth, it's silky, it's clear.
Mm.
It can be put in the lips. It can be put anywhere,
Everybody knows.
but it can last up to 5 years.
Up to 5 years.
Which is great. That's what the manufacturer says, 5 years.
It's different for everybody.
Everybody's different, and some people it'll last longer, and some people it'll last less. But I just like the fact that it's a strong, durable filler, and you get the most bang for your buck with that.
All right, you do need a skin test with that product though, Artefill.
Correct. There's a very low rate of people being allergic to it, so we always do a skin test. It's like a TB test.
TB, right, that's what I
Right, so you
thought.
got to wait for 28 days after that.
That's fine.
But it was taken off the market because the distributor went bankrupt. There was nothing wrong with the product.
The product was desperate, sorely missed by patients
The
and surgeons
distributor went
alike.
bankrupt.
Yeah.
Fine. It just came back on the market. Fortunately, they asked me to be one of the pioneering
Aren't you?
practices.
You're the only one in New Mexico who does it.
I think so. I was one of the first practices to get it back. It's actually coming fully out on the market this summer, but they sent it to me now.
Yeah, he has it
And
early.
so my patients are thrilled because they've been waiting for it. And
Wasn't that story you were pulling it out of the box?
right, I
And
was-
some patient says, "That Artefill, I want it. I've already had my skin test. I'm coming in.
Right.
Let's go."
Right, we
So-
just gotten the shipment, we taken it out of the box, and already the first patient,
Right.
which
That's
is
fun.
great.
Yeah.
So, anyway, you're listening to Talk 1260 KTRC. This is Dr. Daniel Ronel, board certified plastic surgeon, talking about plastic surgery on Western medicine. Thanks for listening. We'll be back in a few minutes.
There's more to come.